We're seeing a growing number of men and women experimenting with anabolic compounds, whether it's for strength, aesthetics, hormone replacement, or perceived vitality. The unfortunate reality is that many are doing this without proper education, without medical monitoring, and without understanding the long-term risks. I'm Dr. Christensen, and I specialize in men's health, metabolic dysfunction, and performance-based longevity care. This video is not medical advice, and it's educational, and it's based on clinical insight and ongoing conversations I've had with patients and the perspective I bring as someone who's trained in both integrative and conventional models of care. Today, I want to open up a conversation about anabolic steroids, and more specifically, the difference between traditional cycles and what I consider to be a far more intelligent, sustainable strategy. We're seeing a growing number of men and women experimenting with anabolic compounds, whether it's for strength, aesthetics, hormone replacement, or perceived vitality. The unfortunate reality is that many are doing this without proper education, without medical monitoring, and without understanding the long-term risks. Now, traditionally, anabolic use has followed what's called a blast and cruise model. You'll hear about high-dose cycles over a 12 to 16 weeks, sometimes more, where multiple compounds are stacked, sometimes aggressively. Then there's a crash, or what's called PCT, where users hope their natural hormone function rebounds. On the other hand, there's an approach I've seen starting to evolve, both in research and clinical practice, that's more measured. And some might know already, it's called microdosing. Now, let me be clear, this is not a recommendation or a protocol, but it is a concept I talk about when patients ask about how to think about safer use. Microdosing isn't about taking tiny amounts to get huge. It's about staying within a therapeutic window that supports your goals without triggering a massive side effects or shutting down your system. The philosophy is very simple. Start with one variable, establish how your body responds, monitor the key health markers, and from there, only if medically appropriate, you make small data-informed adjustments. This also applies to testosterone, but also to other anabolic agents that are sometimes used therapeutically. Now, in this case, I don't believe in throwing the kitchen sink at the body and hope for the best. That's where I've seen the most damage happen. Hormone crashes, cardiovascular issues, infertility, mood disruption, and unfortunately, many of these outcomes stem not just from the compounds themselves, but from how they're misused and often without oversight. What I've learned, especially under the mentorship of Dr. Thomas O'Connor, is that most sustainable path isn't about how much you take, it's about how careful you approach the process. When we frame anabolic therapy as a clinical decision, not an emotional or ego-driven one, it changes the entire conversation. Now we're talking about risk mitigation, monitoring, long-term endocrine function, and quality of life, not just size or short-term strength. And that's what microdosing supports. It's not about being conservative for the sake of it. It's about being intentional. It's about finding the sweet spot where benefit and safety intersect. In my clinical world, when these conversations come up, we're not rushing into cycles. We're assessing labs, symptoms, goals, lifestyle, and long-term vision. And even then, the conversation isn't about what's the strongest dose. It's what's the least I can do to get the effect I'm looking for, without compromising anything else. Because let's be honest, longevity doesn't come from reckless stacking. It comes from clarity, control, and consistency. So if you're watching this and you felt overwhelmed by the culture around anabolic use, or you've been tempted to follow what your gym buddy told you to do or your trainer, just pause. Ask yourself if the way you're approaching this is setting you up for success 5, 10, or 20 years from now. I'm not here to tell you what to do. That's not my job. But I am here to offer a different lens, one that's built on physiology, not bro science. If this message resonates, share it. Because the more we normalize informed discussion, the less damage we will see from uninformed experimentation. And if you want to keep learning about hormones, performance, and how to make smarter choices for your health, subscribe and stay tuned. Take care of yourself, stay smart, stay strong, and I'll see you in the next one.